Streaming, okay, fine, it's going on. Yeah, fine. Are you able to hear me? Are you able to hear me? Are you able to hear me? Am I audible to you? Am I audible to you? Am I audible to you? Am I audible? Yes. Am I audible to you? Hi, welcome you all to Unacademy, and this is my first live session. I'm Liyamol Biju. So let's crack it together. So more about Unacademy. Unacademy is an online platform where you are able to have live classes, and that's our specialty, where you can interact directly with us. So about me, I have done my bachelor's in English literature, master's in English literature, and currently I am a research scholar, and I have more than 3 years of teaching experience. So this is my Telegram link. You can also WhatsApp me for any enquiries or for any doubt. So you can actually prepare with the top educators across our country in a single destination. That's a specialty of Unacademy, and you're having comprehensive syllabuses, live classes. So this is all about UPSC subscription, CSE subscription. It's of different plans like this: 1 month, 3 month, 6 month, and 12 month. So actually you can use my user code, and my user code is Biju, to avail discount, that is of 10% discount you will be availing if you're using my user code. So in this section we are going to deal with COVID-19. You know that, we all know that COVID-19 has impacted the entire society, and many initiatives has been started by government, and you can surely expect a question from this area. So let's start. If you have any doubt in between, you can just message me. I'll reply you back, and I'll retake the classes if you wanted to, if you're not able to understand something. So this is the first thing what we are going to look is COVID-19, a notified disaster. So what do you mean by a disaster? What do you mean by a disaster? Disaster is something that affect an entire society, which misshape and or it may be something that occurs in a grave area, or it is something that extremely disrupting the function of a particular society, which can cause widespread loss. It might be human, materialistic loss, everything. Such thing is known as a disaster, and India has declared COVID-19 as a notified disaster. So this is a definition according to Disaster Management Act of 2005. We know how Disaster Management Act came. We have to just analyze it. In the beginning, there was no such a community or something to check after the disasters. When our country was prone to more and more disaster, in the year 1999, government decided to set up an authority, an act also, and that act has evolved and it has amended to timely time, and we follow the Disaster Management Act of 2005. So a disaster is defined as a catastrophe, a mishap, calamity, or grave occurrence in any area arising from natural or man-made causes, or which can cause substantial loss of a life or human suffering. So when and how? Okay, and one more important thing you have to note that in 1999 this has been divided into 31 categories. 31 categories of disaster has been identified. And when you come to disaster management, there is no executive or legal provision to declare a national calamity in our country. See, in the wake of 2018 Kerala flood, Uttarakhand flood of 2013, the cyclone of Andhra Pradesh 2014, and Assam flood of 2015, different states asked the central to frame a law so that it can be declared as a national calamity. So just remember this point, because this can be asked in a confusion way, like when your statements are given, consider the following statement and it's given, there is an executive or legal provision to declare a national calamity. If such statement is given, it's wrong. Here there is no executive or legal provision in our country to declare any national calamity. So we are going to discuss the funding. How the fund is being distributed. The fund is being distributed by two sources. Obviously, if something a national calamity happened, you need fund. So this is the two way, that is State Disaster Relief Fund and National Disaster Relief Fund. And these are some provisions, few provisions, that SDRF will be available state under section 48. 10% of SDRF will be given suddenly if any calamities happened. It will be given suddenly. So this is all about Disaster Management Act and why COVID-19 is being notified, how COVID-19 is a notified disaster. Then the next initiatives come is Stay Home with Book initiative. So this is started during the lockdown period. So people wanted to be safe and their people wanted to be in home, the government started such an initiative, that is stay in, stay home. This is organized by National Book Trust of MHRD. Here the best selling books are being converted into PDFs and it was being made available in the as PDF. So this is a website where you will be able to avail these books. And National Book Trust, when you come to know, it is an autonomous body which was founded in the year 1957, and the books was given in Gujarati, Malayalam, Odia, Nepali, Telugu, Punjabi, Kannada, Sanskrit and Urdu. Also Tagore, Premchand, Mahatma Gandhi's works were being published. Mainly it was focused on children and adults. All the books was available during the time. And let's consider this statements and try to answer it. You can actually answer me. Just go through the sentences. Consider the following statements and identify the initiative. So this is how questions being asked by UPSC. Just go through the question. That is a 2-day online program jointly organized by MHRD, Innovation Cell, AICTE, MIET, Startup Hub, Innovation Curious, to provide a system that can disinfect currency notes or coin. And the third point is it was held on March 27 and March 28. Can anyone try to answer this? Okay, so if anyone is answering, we'll just move with it. Okay, so are you able to answer the question? See, I'll read it once more. Just think for a while. This is how the UPSC usually asks questions. Consider the following statements and identify the initiative. So, a 2-day online program jointly organized by MHRD, Innovation Cell, AICTE, MIET, Startup Hub, Innovation Curious, to provide a system that can disinfect currency notes or coins. It was held on March 27 and 28. So, options are Atulya, Ayusaksha, COVID Beep and Ideothon. So, the answer here is Ideothon. We'll see what is it. So, you got an idea about Ideothon. Ideothon was a 2-day initiative, an online initiative which was jointly organized by MHRD. Okay, what is its main aim? It was to aim to diagnosing the suspected and isolating the treated infected, creating actionable awareness among the able to hear me. So the next thing is Atulya. Okay, what is Atulya? Atulya is, as the picture say, it was a microwave sterilizer. This is such a kind that was implemented for the first time, a microwave sterilizer. This is developed by DIT Pune. That is Defense Institute of Advanced Technology has developed this. And actually you can segregate the virus using a differential heat of 56 to 60 degrees Celsius. Also, it need an sterilization time of actually nearly 100 samples were collected and being tested. Okay, then we are going to discuss the next important initiative by the government, that is RTPCR Lab, India's first PCR lab launched in Karnataka. See, Are you able to hear me? Is there any problem? See the question. Consider the following statements and identify the initiative. That is a 2-day online program jointly organized by MHRD, Innovation Cell, AICTC, MIET, Startup Hub, Innovation Curious to provide a system that can disinfect currency notes or coins. And it was held on March 27 and 28. The questions you can expect like this. And we go through the options like Atulya, Ayuksha, COVID Beep and Ideothon. And answer was Ideothon. So I hope you are clear with all these 4. And we moved on to Kozwara. Kozwara is something being used to test the coronavirus using your sound, how you cough, how your respiratory sounds. All this is being used. And next we comes with RTPCR Lab. This is something for the first time being used. What is this RTPCR Lab? It has been launched in Karnataka and it is for the first mobile RT-PCR lab has been used. What is this RT stand for? Reverse Transition Polymerase Chain Reaction. RT-PCR stands for Reverse Transmission Polymerase Chain Reaction, and is a mobile infection testing and reporting. That is another name given to this. What is the advantage of this? Is molecular diagnosis of hotspot can be done very quickly, and this is something of first kind. And here what is being done is RNA is being changed to DNA in this during the process, and also it has been used nearly 9,000 tests per month. So are you still facing any issues with this? Means, are you able to hear me properly? So we are moving to the next. Use all these stuffs. This is Ayush Kavach COVID app. See, please note down the names of this app because it's a bit confusing when you're going to the next. Means same, it sounds same sometimes. And this is another important resources. Whereas Ayush Sanjeevani app is used to generate the data on the usage of Ayush. That is like how the people are being used with this Ayush. What does this Ayush stands for? A is for Ayurveda, Yoga, Naturopathy and Urani, Siddha, Saurabha and Homeopathy. This is Ayush Sanjeevani app. Let's move with the next. Okay, are you able to hear me? I think there is some network issues. Don't mind, we'll move the next session, that is reusable antimicrobial mask. Reusable antimicrobial mask. What is important is it is launched by NanoSafe Solution. NanoSafe Solution is a startup of IIT Delhi. This is a startup of IIT Delhi, and this is such that first kind of fabric based on antimicrobial face mask which can be used up to 50 times after washing, or 50 laundering can be used. What is the specialty of this mask is it contains 3 layers which protect us, like inner hydrophilic layer for comfort, middle layer having antimicrobial, government sponsor, but it's a public private initiative. Here its aim is to include 20 lakh of retailers 20 lakh of retailers are being asked to included here. That is 20 lakh of retailers are being used. Okay. This is not only used for groceries but also for the consumable durables, apparel, saloons. Its main aim is to educate Kirana store owners to teach them the COVID-19 protocol, and which is set up by FSSAI and Ministry of Home Affairs has already set up some rules, and they have to follow these rules. It is for the safety measures. FCMG companies will be asked to provide training and mobile health kits like masks, gloves and sanitizers to enable them a Suraksha store. Every Kirana store is being converted to the Suraksha store. That is the aim of the government, and nearly 20 lakh retailers are being involved in this. The next we are moving to the next session, that is COVID Jagruda Portal. This is a one-step platform for public to avail emergency services. So in this portal, the people are getting every information related to the COVID-19, the transparency, and this is very transparent, and all the government is being used. What and how it is being monitored? This is being monitored using this device is known as pulse oximeter. The pulse oximeter is a small device that can be clipped onto the finger for reading Bangalore Mahangara Palika. And next is National Innovation Foundation organized an event known as Challenge COVID-19 Competition. Challenge COVID-19 Competition C3. This campaign, it was a campaign that run from March 31st to March to 10th May. So when UPSC asks a question, it will be like this. Consider the following statements. Campaign run from 31st March to 10th May, organized by National Innovation Foundation to come up with ideas and innovation to tackle the pandemic. Which of the following statements are correct regarding a challenge COVID-19 competition C3? So this is the way the UPSC asks the question, so you can easily sort out. So this is the purpose of the foundation, to ideas and innovation to tackle the pandemic. It asks the people to come with many ideas and innovation. And what is NIF? That is the COVID-19 precision tracking of the spread of COVID-19, access, curated and relevant advisory. So this is why ArogyaSedu app has been involved. It's something like a public-private partnership which assess themselves for the risk for they are catching coronavirus infection. It is something based on tracking like YouTube and all. Once your app is you are installing this app for once. What is happening here? The app to use your Android phone, you actually have to download this. Once you are using this, the app started to utilize the things and it will be monitoring you. If you are like a corona patient, it will be monitoring the patient at home and assisting them if they have any problems. So one more problem has been raised with this ArogyaSedu app, that is regarding the privacy issues. So regarding the transparency of the app, so many problems has arisen, and the government has set up a code which is transparent, like an open source, refer to a source which people can modify and using the database. Also, Bug Bounty Program. A program which is associated with ArogyaSedu app is Bug Bounty Program. It was related to the privacy concern of this app with assistance of National Information Center. It is regarding the security measures. So, it also rewarded 1 lakh rupees for the innovators with ideas to check the privacy, to check the security concerns of the people, the bug bounty program. It will cost the based on the interaction with other using cutting edges, Bluetooth technologies, algorithms and artificial intelligence is being used here. Once installed, the app will directly of the app will directly use the phone and utilize it, and you can have a direct link with the patient. This is all about ArogyaSedu app, and we'll move to another question. The question is, consider the following statement regarding hydroxychloroquine. So go through the statement for a while. Like, hydroxychloroquine is a drug used to prevent or treat malaria. Hydroxychloroquine is a scheduled H drug. So which of the following statements are correct? So when you are coming to this, possible question from this area is regarding the schedules of the hydroxychloroquine. Okay. So any drug is scheduled into 3 types, that is Schedule H, Schedule X and Schedule H1. So what is schedule? This is something known as Schedule H1 drug. This is, according to 2013, indiscriminate use of antibiotics, anti-TBs and drug, you will be banned here. So in order to monitor that, the prescription has to be preserved by the chemist for at least 3 years, and in the back you can see this red box. It will be given in a red box, and also there will be a symbol of RAX. Then another symbol will be given here, that is, I hope you can see it. This is also RX. XRS is a registered medical prescription have to give this drug, which is used for narcotics and physiotherapeutic drug, which will be sold on the prescription of registered medical officers only. And 2 years this has to be stored, the data has to be stored for the 2 years. This is all about Schedule H, X and H1 drugs. Next we are going to deal with the Chinese government recommends beer bile as a cure for Covid-19. Okay. On the basis of novel corona, the government has so we are moving with the next thing is, that is National Preparedness Survey, otherwise known as National Corona Survey. The Covid-19 National Preparedness Survey was conducted in 410 districts in the country. Okay, and 410 officers were involved in this. Why? Like across the state, because the people like the district collectors and all having direct contact with the people, so they can communicate with the people and they can help the people to preparing against the pandemic. To highlight the main priorities and constraints of COVID-19 preparedness as they are preset by the civil servants working in the field to access enabling factors in making institutional or logistical hospital preparedness. So why this was conducted? This was conducted how to create a hospital and how to aware the people about this so they can be used it. This is all National Preparedness Survey. It was conducted within the 3 working days to obtain a bridge view of governance challenges of the national while coping with great health crisis India faced since independence. This is something, another initiative that is known as Karuna. Karuna is a unique collaborative platform that brings together civil servants, industry leaders, NGO professionals and IT professionals. So it is a joint collaboration done by the research department to monitor and to boost the awareness among the people. Now, other fact we are going to look is Operation Shield. The full form of SHIELD is S stands for sealing, H for home quarantine, I for isolation and tracing, E for essential supply of commodities, L for local sanitation, D for door-to-door health checks. So, this is an innovation by Delhi government. Shield is something innovated by the Delhi government. It is something like to protect the people. So, this has been divided into 5 different zones, and where each and every people are being observed and they cannot come out of the home. They have to be stay within the home. And as the name suggests, it will to the immediate surrounding after geographical marking. Here the hotspots has been decided. Okay, the people living in the hotspots cannot come out. They will be checked with the home quarantine and all the measures will be done by the government, and they also will check about the local sanitations, and door-to-door checkups are being done on every living area. This is all about Shield, Operation Shield. This is something related to Corona. So many other operations related names will be there. So don't confuse it with Operation Shield is something related to coronavirus. And next important thing is RO. What is RO? R stand for R naught. Simply it's known as R naught. Okay. This is something related to how the coronavirus is increasing. It is used to calculate how this is being increased. Like this, see, if there is one patient, for example, one patient is there, it has transmitted to another 2 patients. Again, it will be transmitted by this one patient to another 2 patients. This is known as RO, and it is something used to calculate how the corona is being spread, or RO is equal to new infection divided by the existing infection. It is used to check the average number of people who will contract with the virus from a person who has already been infected in a population that does not have immunity for this disease. And important thing is its variability. Okay, if RO is 1 means it is remaining constant. RO1 means it's remaining constant. Like, how is it? That one patient was there, he transferred the disease to the another patient. When one patient was cured, another person is there. That is RO1. If RO is less than 1, what it means? If RO is less than 1, it means that it is under control. If RO becomes 0, that means there is no disease. So what is the RO of COVID? It is from 1.4 to 2.5. That is the RO of COVID. So another measure by the government is COVSAC. This is something developed by Research Development Authority, that is by DRDL, Hyderabad. Okay, and it is another it's also organized with Defense and Development Organization to combat coronavirus to developing a sample collection of known as COVSAC. So COVSAC is something, or KIZOC is something used to collect the samples, and it is being developed by the research department, Defense Research Department, along with Development Laboratory has innovated this. It is something used by the nasal or oral swab of a person is being taken by healthcare professional from outside with a built-in gloves. This is the advantage of this. There won't be any direct contact with this patients. It is developed by in consultation with the doctors of Employment State Insurance Corporation, ESCI, Hyderabad. The KIZOC is automatically disinfected without the need for human involvement, making the process free of infection spread. So, disinfected without the need for human involvement. There is no need of human involvement here. Here directly the oral swab is being collected by the health professional from outside through a built-in gloves. This is the advantage of COVSAC. Then another important initiative is Seva. So what is Seva? It is a direct connection with the government. The people can directly contact with the government, and the government will be responding to them immediately. That is Seva, and get them responded immediately. It is being launched by the Ministry of Health and Family Welfare. It is something very interactive, and it's a direct channel where anybody, including me and you, can directly communicate with the government, which enable to establish a direct channel to the Indian citizen, connecting with the real-time provide authoritative health and public information. The next thing what we are going to see is SIAM is another app which is launched by the Municipal Corporation of Pune, which has a GPS tracking system is there for this, and in here different zones are being created and the people are being monitored directly using this app, and three colors are also being given. That is the first color, that is red. Here the signifies that person has stayed out for a longer duration. It check whether the person who is in quarantine move. How does the person in quarantine move? This is the main purpose of this app, to check it. Okay, here red signifies that person has stayed out for a longer duration. Yellow says that the person had made limited movements. And what about green? It says that it had confined himself to house limits, that he was in the house itself, he never moved out. So this is used by GPS tracking. Next is HCARD. What is it? Its full form is Hospital Care Assistive Robotic Device. This is to help the doctors, and it was developed by Central Medical Engineering Research Institute, and this is an automated robot targeted in helping the people in the front line, healthcare workers. Its main initiative is to help the healthcare workers who are treating the COVID-19 patients, so that if using this robot, there won't be any direct contact by the workers to the people. So the robot itself weighs less than 80 kg, that's all its weights, and it can be built at a total cost of less than 5 lakh. So next we are moving with National Monitoring Dashboard. This is an initiative conducted by DARPGS. What is this DARPS? Department of Administrative Reforms and Public Grievances is known as DARPS. So what is the main aim? It is addressing the grievances of the people, aimed at addressing grievances of central government and state government and union territories. So grievances, complaints can be monitored using this device. And centralized public redress and monitoring system will be monitored by the priority by DPRG team. So what is this? This centralized public grievances redress and monitoring system will be monitoring this. And what is this institute? This institute was started by 2007. So any citizen, anytime, who is the head of this institutions? That is Prime Minister. The recommendations of empowered group of officers 10 constituted under the Disaster Management Act has recommended this. So this is a recommendation given by this people so that they can have a direct contact with the people, and the people want to know about it. The government want to connect with the people, and the government want to connect with government. That is, central government want to connect with the state government want to connect with the central government. So we are going to move with two other programs, that is Ukkuti and Ukkuti 2.02. This is something different. What is Ukkuti? Ukkuti stands for Young India Compacting COVID with Knowledge, Technology and Innovation. It is a unique portal which is developed by the MHRD to record the efforts and initiatives. So here mainly all the initiatives done by the government is being recorded, and it will cover almost all the institutions, especially when it comes to the academic level. Since it's COVID is going on, every students want to be in home, so they wanted to monitor them, how their betterment, how they can be developed in this time, how the online technologies can be used. All these things have to be checked and to be taken initiative. So MHRD has formed this Ukkuti to associate with the students. The portal will cover both qualitative and quantitative parameters for effective delivery of services to the academic community at large. So it will be having a direct communication with the academic community. Development and research will be given. The portal will also allow various institutions to share their strategies for various challenges which are because of the unprecedented situation of COVID-19 and other future initiatives. The another initiative is Ukkuti 2.0. First we discussed is Ukkuti, simply Ukkuti. Another one is Ukkuti 2. What is it? Here already developed and ideas has been taken. Here it is identifying the incubators and relevant ideas has been taken during the coronavirus pandemic. It's actually the logical extension of Ukkuti. Like Ukkuti 2 will also help in fostering the cultural innovation and internship in an academic institution. It has checking the academic institutions and how it is going, how it is being identified, what are the functions being done, how can you develop it. And it mainly focus on the cultural innovation and entrepreneurship. So the data, when collecting the data, this will give a complete picture of the higher education and their present situation, and it helps us to develop the institutions. This also helps the government to identify the bottlenecks and formulate appropriate policies to strengthen the innovations ecosystem in the country. So ministry will be provide the best possible to help the support creative innovation and technologies to help society at large. Another important term which is related with corona or COVID-19 is pool testing. What is this? Pool testing is an algorithm. Here multiple samples are being collected at a time and screening is done to PCR test. That means 1 or 2 samples will be collected. Okay. And same time testing will be done. So if 1 or 2 is tested positive, that case will be considered as positive. If not, it will be considered as negative. In case the pooled test turns around to be positive, individual samples are tested, which is referred to a pool deconvolution, and this term is known as deconvolution. The process is simple. Here 1 or 2 patients samples will be collected and directly it will be monitored, directly it will be checked. So 2 or 3 will be simultaneously tested for corona. And if one person is considering it is coming as positive, then that group will be considered as positive, others negative. And the problem here is only 2 to 5 samples can be used at a single time. Only 2 to 5 samples can be used. This is known as pooled testing. Another important is online ASEAN Summit. A special summit has been conducted on the COVID-19 challenge, and it was the third time, and it is the 36th ASEAN Summit, and Vietnam has hosted it. Vietnam is hosting it for the third time. That is the first in the year 1995 and second in the year 1998 and in 2010, and now it is in 2020 it has conducted the online summit. It was in the year 1995 Vietnam joined the ASEAN, and later in 1998 and 2010 they had conducted the summit. And this is something very relevant because this is for the first time an online summit has been conducted. Why this summit is being conducted and what are the major initiatives being discussed there? Here the problem, what is the main problem we faced with corona when after the COVID is, it want to discuss the post-COVID effect and how to improve the economy, because already the economy is completely collapsed. Tourism sector is completely collapsed. People are losing their jobs. How to compromise all these things and how to compact with this? That is a main discussion in the online ASEAN Summit. Stocks of ASEAN community building effort, challenges, adapt a number of key documents to improve the lives of people of ASEAN post COVID-19. See, people have to be protected. Why? Because there will be problem with the food supplies, because there was no cultivation, there was no things going on. So how to compensate all these things, how to help each other, all these things were being discussed mainly in the online ASEAN Summit, which is hosted by Vietnam. And what is ASEAN? ASEAN was first founded in Bangkok on Thailand on 8th August 1967. There were 5 founding members like Indonesia, Malaysia, Philippines, Singapore and Thailand. So this is all about online ASEAN Summit. Then we are going to discuss with the dashboard of coronavirus. What is this? It is actually a database pool to check or help the COVID warriors, which include doctors, of Ayush, nurses, everybody, that is of medical professionals and the volunteers. Okay, this is something we are going to the ground level, like to the state, district and municipal levels, and data being collected and how they have to be protected, how can they be helped. So here what is a useful thing is that the corona team, the COVID warriors can directly have communicate with each other, they can know to each other and they can help each other. Say database of details of healthcare professionals and volunteers have been made operational. So contact details of the nodal officers will be provided. So it also discusses about the crisis management and contingency plan based on the available resources, how to overcome the problems. And finally we are moving with Action COVID-19 Team ACT. So here is a grant has been given of 100 crores grant has been provided to support the innovators during the COVID-19 pandemic. And how it is given, how to control, who can control it, what are the various methods or techniques can be implemented. Such kinds of people as being awarded a grant here. And now these are the following groups who has got the grant, like My Lab. Here its aiming is like South Korea. Here a South Korean model is being adapted, and here grant is being given to test the coronavirus. See, it is a Pune based lab. First indigenous COVID testing kit has been manufactured here. So a grant is being given to them. Okay, so what is My Lab? My Lab was founded in the year 2016. Okay, here My Lab has created a reverse transcription polymerase chain reaction which is manufactured domestically and a local supply chain is being provided, which is approved by Indian Council of Medical Research. So this is something of first kind of this, and it is very cheaper than any other international counterpart. That is a speciality. Then the another initiative which is Karkana. Here a personal protecting equipment, that is PPP, have been given and it has received 20 lakh rupees. Okay. Why PPE is very important? It is being delivered to the COVID warriors, especially to the doctors and nurses. Okay. The startup is using technologies like 3D printing, injecting moduling, machining, fabrication and design facility to scale up production of PPEs. Some of the equipment manufactured by Mumbai-based Karkana are face shield, Astral boxes, Googles, etc. Then another one is Corona Safe. It's a live data system which can prove extremely effective tackling the spread of coronavirus. So Corona Safe is used to tackling the spread of coronavirus. Here a sum of 50 lakhs has been awarded. Actually, the startup has helped the Kerala to set up a live dashboard. This is all about Corona Safe. Then Fasana. Fasana is to meet the shortage of PPEs in our country. Fasana is providing a scalable demand supply matching profit. So we are facing issues with the PPE products because of there is a lack of manufacture. Here this Fasana is meeting up all these things and ACT has granted them 20 lakh rupees for this. See here, just you have to know this initiatives by the people like Fasana, Corona Safe. You have to know what is it. And it also has provided a sum to Covid-19 Helpline, which is working into 24/7 to spread the awareness of Corona among the people. Okay, 25 lakhs has been given. The smooth functioning. What is a year also suggests telemedicine is being also given using Covid-19 Helpline. Okay. This is all about thing. So we are stopping the class here. I hope you have got it. There was some trouble with the internet. We'll see soon and we'll continue the class next session. So this is my user code BIJ. You can avail a discount. Thank you.